Good morning to all of you, to Gisela, to our sign language interpreter, and to all those who make this broadcast possible, and most importantly, to everyone tuning in each morning. Today, 1,135 people are hospitalized in Cuba. 30 are under observation. There are 571 suspected cases and 534 confirmed active cases. A high number given the amount of confirmed cases reported over recent days. Yesterday, over 4,000 samples were processed. 4,256 were processed in our various molecular biology laboratories to detect COVID-19. 1,989 were processed at the Pedro Curie Tropical Medicine Institute, 659 in Havana's Hygiene, Epidemiology and Microbiology Center, 409 in Villa Claras, 275 in Santiago de Cuba, 438 in the Genetic Engineering and Biotechnology Center Lab, 352 in the Hermanos Aimajeires Hospital Laboratory, and 134 in the Civil Defense Laboratories. Of the 4,256 samples processed, 35 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 309,908, of which 3,128, or 1.01%, have tested positive for the virus. Yesterday, samples were tested from all of the country's provinces, the highest number from provinces where outbreaks or important episodes of local transmission have occurred. For example, 832 were processed from Artemisa, 2,640 from Havana, 85 from Mayabeque, 74 from Matanzas, 185 from Villa Clara, 110 from Santiago de Cuba, and so on and so forth from all of the country's provinces, to immediately detect any and all cases. Of the 35 positive cases diagnosed yesterday, all are Cubans. 26, or 74.2%, of positive cases yesterday are confirmed case contacts. This brings the total number of confirmed case contacts to 83.7% of all diagnosed cases, which means that this group runs the highest risk of contracting the virus. Of the 35 cases diagnosed yesterday, the source of infection linked to 9 is yet to be determined. This is something we've been working on and will continue to investigate, because I know that we are all aware of the importance of identifying the source of infection in order to treat the patient and all those that they have come into contact with. This brings the total number of cases where it has not been possible to determine the source of infection in Cuba to 192. No imported cases were reported yesterday, nor did any foreigners test positive for the virus. Nonetheless, since the pandemic began in Cuba, 310 people have contracted the virus abroad. 18 people diagnosed yesterday are male, for 50.6% of all cases. Meanwhile, 17 are female, representing 49.4% of all diagnosed cases. As you can see, a similar rate between both sexes, a trend we've seen in Cuba and worldwide. 19 of the 35, or 54.2%, were asymptomatic at the time of testing. These cases account for 57.5% of all positive cases on the island. When we look at this figure over the last 15 days, it rises to 69.4%. The absence of symptoms is a characteristic feature of COVID-19, one which sets it apart from other infectious diseases and makes it harder to control for any country. because it means that there is a significant number of people with the virus but without symptoms, who then go on to infect others. By age group, of the 35 positive cases yesterday, 6 are under the age of 20, for a total of 341 children and young people under 20 to have tested positive for the virus in Cuba, of which 301, or 88.3%, of cases in this age group have been discharged from hospital. Meanwhile, 16 are between 20 and 40 years of age. 8 are between 41 and 60 years of age, and 5 are over the age of 60. Of the 35 positive cases yesterday, 29 belong to Havana and the municipalities of Habana del Este, Marianao, Boyeros, Plaza, 10 de Octubre, La Lisa, Cerro, San Miguel, Arroyo Naranjo, and Playa. As you can see, cases are spread across different areas of Havana. 2 cases diagnosed yesterday are from Artemisa and the municipality of Mariel. Villa Clara also reported 2 cases yesterday from Camajuaní and Manicaragua, the latter linked to the outbreak that occurred in the former. 1 case was diagnosed from Matanzas yesterday, in the municipality of the same name, the source of infection connected to which is still being investigated. 1 other case from Holguín and the municipality of Moa tested positive yesterday, and the source of infection is still being determined. Yesterday's results therefore mean that Artemisa continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 21.75. Havana follows with a rate of 14.66 per 100,000 inhabitants. Then Villa Clara with 2.57, Las Tunas with 0.37, Pinar del Rio with 0.17, and Matanzas and Holguín now join the list. Matanzas with a rate of 0.14 and Holguín with 0.1. This means that Cuba's rate also increases, now standing at 16.98 per 100,000 inhabitants. Of the 3,128 people who have been diagnosed with the virus thus far in Cuba, 534, or 17.1%, are active hospitalized cases, of which 528, or 98.9%, are clinically stable. No COVID-19 related deaths have been reported in Cuba over the last 8 days, meaning that the island's mortality rate drops to 2.81%, which, compared with the regional rate of 3.64%, places Cuba in 21st position in the Americas, and compared with the global rate of 3.66%, puts it in 113th in the world, after Namibia's overall case rate surpassed Cuba's yesterday. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 32 people were discharged from hospital. As you can see, we are gradually moving towards a positive ratio, with more daily discharges than confirmed cases. Of the 32, 17 are from Havana, 13 from Artemisa, 1 is from Cienfuegos, and another is from Santiago de Cuba. This means that to date, 2,504 people, or 80.1% of all confirmed cases in Cuba, have recovered from the virus. There continue to be 2 critical cases, being treated at the Pedro Curi Tropical Medicine Institute and Salvador Allende Hospital, as well as 4 serious cases, one of which is hospitalized in the Pedro Curi Tropical Medicine Institute, while the 3 others are in the Salvador Allende Hospital. The status of one patient changed from serious to stable yesterday, while another, from Havana, joined the list of serious patients. Now we're going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. There are now 20 million cases of COVID-19 worldwide, 20,075,600 to be exact, after 229,812 people were diagnosed with the virus yesterday. Yesterday, 5,109 people died of the virus, for a total of 736,372 COVID-19 fatalities worldwide, and a mortality rate of 3.66%. The region of the Americas accounts for practically 54% of all COVID-19 cases worldwide, with 10,831,661 confirmed cases, after 106,502 new cases were reported yesterday. 2,765 COVID-19 fatalities occurred in the region yesterday, bringing the death toll in the Americas to 394,744, and a mortality rate of 3.64%. Just like yesterday, the United States continues to top the list of countries with the highest number of cases, with over 5 million, and more than 163,000 deaths. Brazil follows with over 3 million confirmed cases and 101,000 fatalities. Then India with over 2 million confirmed cases and 45,257 deaths. These figures reflect how difficult it is to control the virus. This is the information that we have on the behavior of the pandemic in Cuba and the world.